Welcome to the New York, New Jersey Consortium's How-To Guide for the Clinical Instructor. There are 3 clinical instructor training modules. Module 3, Managing the Clinical Experience, Communication and Feedback. Effective communication and feedback can maximize the learning experience for both the student and the clinical instructor. Appreciate that there are different communication, social, and learning styles. Take time to understand each person's preferences for interacting with others and for problem solving. It can help to maximize outcomes. Some people are more analytical and approach decision-making through facts and logic. Some are more amiable and like to build relationships, trust, and be assured of personal commitment. Some are more driving and are action-oriented, preferring organization and efficiency. The expressive person tends to rely more on intuition. Recognizing, acknowledging, valuing, and meeting individuals of different styles where they are can facilitate successful communication. Self-control and composure. Coping skills such as counting 1 to 10 or back from 100, deep breathing, using visual imagery to picture positive outcomes can help for keeping calm and focused when dealing with frustrating and/or stressful situations. Be proactive. Direct your energies towards problem solving rather than focusing on answering the whys. The whys are less important than knowing what you need to do to go forward and improve. Actively listen to what the other person is saying. Active listening is an attempt to understand and not just hear what the other person is saying. Show that you are listening by keeping eyes focused on the other person, nodding your head, clarifying by paraphrasing and asking questions. Match verbs. So for example, if they're using visual verbs, they might be saying, "It looks like this to me. I picture it this way." Match those verbs. If they're using auditory verbs, they might be saying things like, "It sounds like," or "I hear." And kinesthetic, "I feel." Be mindful and present in the moment. Listen empathetically by being mindful of the emotions behind the facts. Provide psychological space in the conversation so there is time for information to register. Pick your battles. Start with what is going well and then approach 3 issues that can be better. Bringing in too many issues can overwhelm the student. And remember to separate the person from the issue. Focus on the behaviors and issues you observed and how they make you feel. Avoid using sentences with "you" words, such as "you are angry," which can put the other person on the defensive. Instead say, "I sense you are not happy with what happened." The next segment is on guidelines for constructive feedback. Before you start giving somebody feedback, make sure you're in the right mindset. Try to find a little quiet time first. Calm yourself. Make sure you have no expectations of how the other person might respond. Be open-minded. Focus on the what, not the who. So take the focus away from the individual and put it on what are the actual things that happened that you want to address. What are the actual issues? Give specific examples. Explain the impact of those examples on patient care, on other relationships, on things that have happened. Then give time for what you said to register, so give psychological space. Outline what the next steps are going forward, and then afterwards follow up and follow through with your feedback. Be open during the conversation with intent to learn. Find out what it is that the other person is trying to say. What's their side of the story? What can you learn from them before trying to validate your own response? Mirror or repeat back the last word or phrase that was said and add a question mark. This elicits more input without guiding the other person's thoughts. Using the modifying word but negates what was already said. Using the word and can add to what was said rather than negating. If you're not sure what was said, repeat back part of it and then ask for clarification. Is this what you said? Is this what you meant? Provide time to problem solve and reflect rather than an immediate response to each thing the other person says. Here are some pitfalls to avoid when communicating and providing feedback to students. Don't overanalyze the issues. Keep it simple, sweet. Select 2 or 3 issues to discuss at a time. Direct the conversation by sticking to those issues. Addressing too many issues at once can be overwhelming. Problem solve with the student and move on. Ask the student to come up with options for improvement if they are comfortable in the moment, or have them get back to you later in the day or the next morning. Don't perseverate on the issues. Talking too fast may also be overwhelming, especially if the student is overanalyzing the situation or using the information to attack themselves. Talking too slowly can feel demeaning. Avoid intellectualizing the conversation. Monitor the individual's response both verbally and emotionally. Are they listening to what you're saying? If you don't have their attention, pause. Wait for them to come back to the conversation. Using an unpleasant tone of voice, talking too loudly, addressing student challenges in public spaces can all be humiliating and or demeaning and put the student into kinesthetic mode. That's where they are internalizing and not hearing you, or you might be putting them on the defensive. Both scenarios are counterproductive to learning. If the student is using a negative tone or speaking too loudly, you might help them out by reminding them to use inside voices, or you might ask them to reflect for a moment. Are they conveying their response in a way that they feel good about? Will they feel good about it tomorrow? Is there something they can change in how they are communicating? Help them to keep to current issues. Talking about yourself is also generally not helpful. Students don't want to hear what you did when you were in school, clinic, etc. Your situation was different. They may not be able to relate to it at all. If they don't roll their eyes when you are talking about yourself, they are probably thinking it. Placating language such as "don't worry, it will all work out" is not helpful if they don't believe it. Avoid starting conversations with problems. Students will tend to hear only the first thing that you say when you start with a negative issue. Start with the positives or their strengths and then move on to what their challenges are or areas that need improvement. Avoid giving advice or preaching. Instead, ask questions and guide them in problem solving. Be mindful of your facial expressions and mannerisms that convey annoyance and boredom. Remember, there is something for you and for the student to learn in all these situations. See the learning as a challenge and enjoy the ride.